Greetings, this is Dr. Douglas Maurer from iMedical Apps with another medical app review. Today we're going to be taking a look at an app for patients. This app is specifically for patients with cancer and comes from the National Comprehensive Cancer Network, or the NCCN. This is the same group that makes world-renowned guidelines for oncologists. The NCCN is a network of over 27 different world-class cancer centers, and their providers create these evidence-based and expert opinion-based guidelines. They also have versions of these guidelines for patients, and this new app puts these together. As you can see, when you open the app, you see an assortment of PDFs. You can look at all the guidelines for patients here. It also has these quick reference guidelines, which you can see. Some of them, as you can tell, I've downloaded to the device. Others you can just open as you go. So for example, if we open this one here for adolescents and young adults with cancer, they're really just giant PDFs. You can see over 112 pages, and you can scroll through them this way, pinch to zoom, etc. These will work better on a larger device. You then can just tap on the screen, sort by table of content, sort by individual page. You can create bookmarks and favorites along the way. You can share either that entire guideline or just the current page with others from within the app, and send that a variety of ways just based on the different device that you use. With the iPhone, it's pretty robust methods to send. These quick reference guides are really meant to just give the basics of that particular cancer, in this case ALL, some basics of what it is, how do physicians choose treatments, remission options, and then they're linked to that particular ALL guideline in the app, and will open up to that portion of the guideline. So that's pretty nifty. Other options, as you first open the app, it'll show you which ones you've downloaded to the device. It'll tell you about the NCCN guideline for patients. It'll link out to their website. And the website has even more information on it than the app itself does, but it's a pretty nice summary of what's there. Going back to the publications again. Here's another example. This is breast cancer. You can see it's trying to load the guideline here as that green bar goes across. This is a 62-page guideline. It's pretty quick. You can see the glossary that it has a dictionary of terms, which is very helpful for patients. Let's go back to the table of contents, basics, how to use the book, an index, member institutions, the panel members. I love this section here of questions to ask your doctor. So this allows patients to open the app and ask these specific questions at the point of care with their provider to ensure that they get the best possible care. So some things I like about the app: it comes from an authoritative and respected source, the NCCN. It's pretty comprehensive with over 25 different types of cancer spread out over 28 guidelines. It has these 31 different quick reference guides. It's downloadable for offline use if you want to just download specific guidelines for your particular type of cancer. It's also available for Android, which is nice to see for a change. Some things I didn't like about the guideline: as you can see when you first open it, it's pretty simplistic. You have to kind of jump around to get it. You certainly can't see everything in one view, and you have to kind of scroll around to find it, but it's still pretty simple to navigate. These guidelines are really just giant PDFs, and 112 pages is a big PDF, but it's pretty easy to navigate. When you look at the table of contents it has, you also can find specific pages, you can create bookmarks, you can hyperlink into the guideline from the quick reference guide, so that works pretty well. These quick reference guides I think are pretty nice, but they could be a little bit more detailed. As you can see, they literally are just one page and there may be more additional questions that a patient might have. So if you just had this as 2 pages with hyperlinks, particularly since the guideline is 100 and some pages, that might be more helpful for some patients. Although I'm looking at this on an iPhone, the app would probably benefit from a larger screen